cases like this, I will often consider reducing the thyroid medication or removing it to see if this other behavior goes away. But you're definitely going to want to talk to your veterinarian about that, because it really depends on the history as to why the thyroid medication was started in the first place. As far as the inappropriate elimination occurring down in the basement, I've never seen a dog with hypothyroidism or treated hypothyroidism start to have that condition. So what I would say is, when those things are happening, you look at medical reasons and behavioral reasons. So medically, you have to rule out things like urinary tract infection and problems like that. And it sounds like she's doing that by taking the urine sample in. The only thing I don't like is she's taking the urine sample in. I prefer to get it directly from their bladder when they're in the clinic, because if she's catching the urine in a container, there's definitely going to be bacteria in that container. I don't care how clean it is. And they'll actually see that on the urinalysis, and they may think there's an infection. That's why I always perform something called a culture, where I grow the bacteria. And you can actually grow bacteria and decide, was that the type of bacteria that contaminates the sample or the type of bacteria that causes infection? So you deal with those medical things, and then it really becomes a behavioral condition. At 10 years old, there's lots of things that could be going on. Senility, problems with arthritis, immobility on the stairs, all sorts of stuff. So really, you're going to have to rule out the medical problems before you address the behavioral one. I don't think the thyroid is playing a role here, but it's not harmful to maybe back up on that medication, do a trial off of it, and see if this resolves. It's very peculiar, so I would definitely recommend working closely with your veterinarian about that, who originally diagnosed it anyways. But hopefully some of those thoughts come into play. I mean, look, she could restrict her dog from going downstairs, and that might solve the problem right there. But that's really, if there's something underlying this, that's not very good advice. We want to find out really why this has happened. And if we know it's purely behavioral, then we can do things like that, and it makes sense. So good luck with that. I really appreciate the question. Thanks for sending it in, and keep those questions coming to healthcareforpets.com, where we're dedicated to your pet's health.